Thank you, Magali, and it really is a pleasure to be here this morning. I think the two comments that we've heard this morning from both Steve and Magali really are very inspiring, and the Department of Veteran Affairs, I think, does recognize that the situation that we're in, that we're dealing with, is a crisis, and we're treating it like such. And I think you'll see that the attitude now of the Veterans Affairs Department is that while we recognize our substantial role in dealing with the crisis, we really need to do it with partners. And so we welcome and we thank everything that you're doing here. We are really amazed and really admire the efforts that are going on here under your leadership, and we're privileged to be able to be here. In a very short period of time, what I just wanted to do was to talk about the VA's role in 4 areas that are very important to all of you here today as well. And of course, Magali and Steve both mentioned the issue of veteran suicide. I wanted to, okay, I'm sorry, I just had to get used to the clicker. I wanted to just start by sensitizing you to how one of the roles of the Department of Veteran Affairs is to try to get the message out to all of you, to try to reach out to veterans in need and at risk of suicide. So let's listen to this.
I'm good.
I'm good.
I'm good.
I'm good. But I have a story, and I don't know where to start.
I'm good. But I feel alone in the crowd.
I'm good, but nobody understands.
I'm good. The past keeps coming back.
But I can't get out of bed.
And I can't sleep.
I'm good, but I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares that I don't need any help. I'm good, but I don't feel anything anymore.
I'm good. But I can't live like this anymore.
I'm really not so good. Are you ready to listen?
One of the encouraging things to us is so many groups now, and certainly your clinical care network, one of the important ones, now understand the importance of us getting out and addressing and reaching out to veterans that aren't getting help. Of the 20 suicides a day, which is just a horrific number, I think you know that only 6 of them are seeking care within the VA healthcare system, and so many are not seeking care. And so the more that we can get the message out to reach to people, we hope that we can save lives. We do consider this a crisis, and so we're doing several things in the Department of Veteran Affairs. The first is that we are committed to implementing same-day access to mental health care services throughout the VA healthcare system by the end of this year, by the end of this calendar year. And we're working as hard as we possibly can to make sure that there aren't veterans who try to seek care who aren't able to get care that same day. Second thing that we're doing is we are really leveraging partnerships like yours and many others around the country to try to reach out in ways that, frankly, we just haven't done before. And any idea and any effort is really on the table for us. We are also taking our research, just like what you're doing, and trying to put it into clinical practice. So we have a new analytics research platform that identifies those veterans at highest risk, and we're taking it from our research labs this month and putting it into clinical practice to identify patients proactively and then to reach out to veterans who are at high risk and try to see if we can actually address and prevent suicide before it occurs. I think many of you know about our Veterans Crisis Line and the fact that we are dramatically staffing that up. We added this month alone 66 new Veterans Crisis Responders to our lines. We are committed to trying to address the need there. I just wanted to share with you some of these people that are doing this work because you don't often get a chance to see them. So let's see. I think it should play. I don't know where the AV people are, but do I need to do anything or? Let's try that again. Oops. Let's just see. Let's give it a second and just see if maybe there's somebody in the back helping. No. Oh, there wasn't?
I get a phone call.
Okay.
The guy on the other end sounded intoxicated. I said, "Are you planning on killing yourself?" And he said, "Yes."
There is always this question about whether or not suicide is preventable. I am here to tell you that it is.
I got him signed into the emergency room, and he grabbed my hand and he said, "Thank you for listening." No one listens. He's still with us.
A suicide prevention coordinator is the local expert on veteran suicide. They range from being nurses to social workers to psychologists. When veterans call the crisis line, they will talk with a responder who can then set them up with their local suicide prevention coordinator.
SPCs are the back half of the Veterans Crisis Line.
The goal of what we do is to meet people where they're at in that really horrible moment.
And get that person with a long-term provider.
You got to be passionate and caring to make a good SPC.
I received counseling after I got out of the Marine Corps. Having been through that experience and knowing that it works for me, I'm a firm believer in what it is that I do. So when a veteran comes to me and says, "You know what, Gare, if it wasn't for you, I'm pretty sure I'd be dead," I get a chill up and down my spine.
That just warms my heart because I live and breathe suicide prevention.
I lost a very dear friend and colleague to suicide. When we posed for a picture, he would put his hand on my shoulder. And I sometimes feel it, that he's there, and he's reassuring me that, "Gary, you're doing the right thing. You're giving my life meaning by saving lives."
There are 300 suicide prevention coordinators serving 22 million veterans.
I connect them with resources inside the VA and outside in the community. In the hospitals, in the churches, family members. Suicide prevention is everyone's business.
The impact can ripple for years. It's not just that one veteran we've saved. It's kids, mother, father, brothers, sisters, friends.
We try and talk to family and friends just as much as we talk to the veteran themselves.
If you're concerned about a veteran, tell them about the VA Suicide Prevention Program. Tell them about the Veterans Crisis Line.
It's really easy to find a suicide prevention team in your area. Just go to veteranscrisisline.net.
If you call, we will work on this together. I've got your back. We've got your back.
I think my dad would be very proud of me. I want to see a world that veterans don't think about suicide and it's not an option, and they know they can come to the VA and get care. And talk to Renee Brown, because I would take good care of them.
So sometimes just seeing a face to the people that are working every day, like so many of you in this room, is really important to do. One of the unique things I think that I found by coming to the VA is the way that we deliver mental health care. We do it in a way that's integrated with primary care. I'm a primary care physician. I've never practiced that way. Today I practice in Manhattan. And having mental health teams as part of the primary care teams is really important. We delivered over 1 million mental health visits in our primary care settings last year, and I think that helps destigmatize the way that we deliver health care. We're also, as Magali mentioned, really trying to advance the work in precision mental health care. Many of you may know about our Million Veterans program. This is where we collect the DNA and do sequencing on what we hope to be 1 million veterans, and then using that for research to advance science. We just reached 500,000 veterans. It makes us the largest database in the country. We were privileged that the President actually came to make that announcement with us last month in Atlanta, Georgia. And now we're actually starting 9 studies using those 500,000 veterans, merging it with our electronic medical record that goes back 25 to 30 years. We have a study right now in precision mental health with 2,000 veterans where we're actually looking at ways to individualize the care and do and advance research. We're working on this, in fact, as part of the Cancer Moonshot program with the Vice President and integrating our mental health work with that. Our research in PTSD, much like you, 130 active projects right now going on in the VA system. And in fact, today, we have an industry day on the other side of Washington where people are coming and presenting their work in PTSD, that we can actually start to see what's happening out there and make sure that we're planning for the right types of new advances that are coming out from the industry. Our research in TBI, also quite significant. This year we'll spend $40 million on TBI research. We are the first federal agency that focused its efforts on TBI, but we also work with other federal agencies and obviously groups like yours to make sure that we're coordinating and synergizing all the efforts that we're doing, particularly with the NIH and Department of Defense. Last year, we treated almost 100,000 veterans with TBI, so significant experience. And we have TBI centers that actually are set up around the country in a center of excellence model with hub and spokes throughout the country to make sure that everyone has access to that type of care. We are doing significant screening for veterans with TBI. As Steve mentioned, we don't have great diagnostics for TBI, but we do have effective screening tools, and I think we're getting better at some of our diagnostic capabilities. Many of you know, and I think you'll hear later on in the conference, about the Neurotrauma Consortium. This was actually a presidential order, and you can see that there's substantial money now with the federal organizations combining to work on this consortium, $62 million between VA and DoD, supporting 10 national studies on the effects of neuro-invasive trauma. Last, I just want to mention something new for the Department of Veteran Affairs, and it actually models very nicely after the work that you're doing. I think, Steve, you set this up really well with a clinical care component and a research component. VA actually adds a third component that I suspect that you're doing too, because I visited your really nice center at NYU with Anthony. We also believe that education is an important part of this, training our future healthcare professionals. So VA is the largest graduate medical education program in the country, sees everything that we do sort of combining our clinical or research and our educational missions. But we just recently launched something called the Center for Compassionate Innovation. And what it really is it's saying that the VA is taking a new approach to these types of issues. Previously, or at least my perspective coming into the VA was that we were very risk adverse. We would only take new ideas after they were already proven and evidence-based. And you know, that's appropriate in many parts of medicine. If you're treating pneumococcal pneumonia, you know, I'm not sure that there's a lot of reason to do experimentation because we have antibiotics that treat pneumococcal pneumonia. But when we're dealing with the conditions that the Cohen Veterans Network is dealing with and Magali, you're dealing with, we don't have all the answers. And I think we have to be open to new ideas because we just have to do better. So we now have a new center that is there to catch and to evaluate new ideas that may not yet be evidence-based, but that have hope and potential and promise to help veterans suffering from these conditions. And so what we're doing now is we're looking at this, and we're doing it through an ethical umbrella so that we're not causing harm. But any new ideas, we want to be working with all of you to make sure that veterans at risk are getting the best that we can, as a country, offer them. And so just in the last couple months, we've taken in lots of new ideas and technologies, and you're going to start seeing those begin to start roll out throughout the VA healthcare system. I think the first one that we did, which is not rocket science, but I hope it will make a difference, is that we expanded our use of service dogs for veterans who have emotional issues and other disabilities. And even though we have a 4-year study underway to look at whether there actually is evidence to suggest that helps, it's just common sense that to me that we shouldn't be withholding this from veterans while this research is going on. So through this type of approach, we've expanded our use of service dogs to new populations of veterans, and we hope that that's going to help. So just wanted to make you aware of that. I know many of you have ideas. I hope that you'll experience that VA is more open than it has in the past, and we've gotten there by listening and learning from groups like yours and listening to families like the Summers family, who I know is here, who has been a strong advocate for us moving forward and changing our approaches, and so many other organizations. So I just want to congratulate you on everything that you're doing here today. We're excited to be part of the effort, and thank you again for everything.